Hi again, everyone. This is going to be a short module over decontamination. So some basic things you need to remember when deconning people. First and foremost, we always want to make sure that everyone's staying safe. So we want to avoid cross-contamination as much as possible. To do this, we want to make sure that everyone stays calm and follows directions. When beginning the decontamination process, you will want to take the simplest approach first. So areas that have come in contact with other objects the most, such as the head, hands, and feet, will most likely be contaminated. So try washing these areas first. Many times, just by removing the clothing, you can reduce contamination by 80 to 90%. When you do remove the clothing, you want to do so as gently as possible. Any rough movement can stir up the radioactive particles into the air and become an inhalation hazard. So to remove items such as shirts, it may be necessary to cut them off instead of pulling them over the head, which could potentially contaminate their head or stir up those radioactive particles. Before you try wet decon, dry decon should be done in order to try to remove contamination, as wet contamination can spread the contamination further. To dry decon, you can use sticky tape or lint rollers to pick up particles. If you need to, you can use wet wipes to clean off the contaminated liquids. To do so, you're going to want to use the pinch and twist method. So place a wet wipe over the contaminated area, pinch to grab the particles, and then twist up and away from the skin. You will need to use a new wet wipe each time. In order to not spread contamination, try to only decon what needs to be decontaminated. So if the whole body does not need to be cleaned, a whole body shower is not necessary. If showering is required, you need to follow specific instructions. First, you will need to prep the decon area and ensure all showering equipment is functioning and there is cleaning supplies available. Each contaminated person will enter the decon area with a radiological monitoring form. You're going to want to review this form to determine the contamination points. As they are removing their clothing, fill out a contaminated personal items form and have them place their clothing into a bag along with that form. You will then provide them with instructions on how to shower properly. Using warm water, not hot, they will be washing starting from their head and working their way down. This way they're not pushing any of the contamination into their face or eyes, into their airway. You're always pushing it down. While washing, you'll want them to gently scrub with soap. If they scrub harshly, they can run the risk of pushing that contamination further down into their skin. Make sure that they are focusing on the folds of their skin, between their fingers and toes, as well as underneath the fingernails. They will want to avoid getting any water in their airways and eyes, as this may lead to some internal contamination. After showering, they will need to make sure to wash their eyes out, nose, mouth, and ears, as well as clearing their throat and nose. So decontamination of vehicles. The method to decon vehicles will be based on the location and type of material contaminated. When washing a vehicle, you will want to stay upwind and stand about 15 to 20 feet away. Work slowly while using a high pressure hose, making sure to avoid getting splashed or sprayed or walking through any of the water runoff. While you are washing, work from top to bottom in order to push the contamination down and off. If there's any greasy or oily surfaces, you may want to use a solvent along with a rag or brush to remove those contaminants. On the inside of the vehicle, do not use water on any porous surface, as you may just soak the contaminants further down into the object. On those surfaces, try using dry decon methods. Once the vehicle is deconned, you're going to want to remove and replace any engine or interior air filters. When deconning any vehicle or equipment, any item that cannot be cleaned without excess time and effort will be considered contaminated waste. Any small equipment that can be wiped down or soaked in a detergent in order to decon can be done so, but if that would harm the equipment in any way, it will also be considered contaminated waste. So again, make sure you are maintaining a chain of custody form for any sensitive equipment. Two things you should remember. One, any contaminated items should be placed into a plastic bag, labeled, and then put into a designated area. And second, at the end of each decontamination operation period, the site must be monitored and decontaminated. As always, you can contact me at the number on the screen if you have any questions over this module. Thank you all.